Hey, you guys, welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting into our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, courses, review books, and videos to assist nurses as well as nurse practitioners with success on boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. We have a 99% pass rate on all of our comprehensive reviews, and a one-on-one. Our one-on-one has a 100% pass rate. Now, I always like to give the disclaimer and reminder we know there's no absolutes in medicine. We treat on a patient by patient basis. And any other questions that I have designed and created for you guys are based on the guidelines that are currently being tested on the ANCC as well as AANP exam. Now, any of my videos that I am teaching on current guidelines and practices, I will always say that so there's no confusion. All right, so with that being said, let's get into question number one for today. Question number one states a patient presents to the office today for follow up. He has a history of COPD and diabetes. The patient states that he has increased shortness of breath and he has not been able to enjoy the summer activities with his kids. His FEV1 is 45% today. He currently takes albuterol. Based on these findings, how should the nurse practitioner treat? Is it A, add salmeterol and administer flu vaccine? B, add salmeterol, pulmonary rehab, and Pulmicort? C, add salmeterol, pulmonary rehab, the flu vaccine, and Pulmicort? Or D, add salmeterol, pulmonary rehab, Pulmicort, and oxygen? Take a moment and tell me what you got in the comments, you guys. All right, you guys, I always recommend reading the stem of the question first so it allows you to slow down and answer what is truly being asked. So here, the stem of the question states, based on these findings, how should the nurse practitioner treat? And you know my rule, whenever there's treatment, a question regarding treatment, we need to run it back and see what the diagnosis is. And if it's provided in the question, if not, then you need to run it back and look at the assessment findings to even determine a diagnosis to be able to treat anything, right? So here, the patient comes in. He is here for follow up. He has a history of COPD and diabetes. He's having increased shortness of breath and said he's not been able to enjoy the summer activities with his children. Now, FEV1 today is 45%. So, first, here we want to look at this because we know he has a history of COPD and there's four stages. Well, if FEV1 of 45% puts him in stage three, the severe stage, right? Because we know we have stage one mild, stage two moderate, stage three severe, and stage four, which is very severe. Well, stage four being very severe is less than 30%. Stage three is anywhere from 30 to 50%, which is this 45 falls right there in the middle of that. So he's in the severe stage. So then you want to think, how do we treat people in that stage, right? So we know we have a short acting PRN as a rescue inhalant. He's already on that. He's already taking the albuterol. So now we need to add in our long acting and continue on, right? So would you do add salmeterol and administer the flu vaccine? Well, you do want to add salmeterol because that is a LABA, a long acting beta agonist, but it's summertime. Remember, he said he's been struggling to enjoy the summer activities with his kids. We don't need to administer a flu vaccine right now. So you can take A out. B, do you want to add salmeterol, pulmonary rehab, and Pulmicort? Yes, that's actually the best answer because B, you want to add in that long acting, the salmeterol. You do want to initiate pulmonary rehab. And we're skipping the flu vaccine because it's not flu season. If it says anything about October through March, then you administer the flu vaccine. And then Pulmicort, we do want to initiate an inhaled corticosteroid. Remembering that Pulmicort is also AKA budesonide, right? Make sure you know your medicine. So if they present it in the either brand name or generic name versus the drug class, that you're able to get the answer correct, okay? All right, question number two. Mr. Hudson is on Coumadin as he has a mechanical valve. He is in the office today to check his PT and INR. His INR is 1 today. He currently takes 5 milligrams PO daily. What is the next best step the nurse practitioner should initiate? Is it A, you want to administer vitamin K? B, nothing. This is a normal INR. C, increase the Coumadin dose by 2.5 milligrams, or D, decrease the Coumadin dose by 2.5 milligrams. Take a moment and tell me what you got. All right, so STEM the question says, what is the next best step the nurse practitioner should initiate, right? So you have a patient that came in, he takes Coumadin, he has a mechanical valve. So his INR is 1. First, you need to know what's therapeutic range for someone on Coumadin with a mechanical valve, right? So we want it anywhere from 2 to 3. So we know that he's not in the range that we're looking for. So would you A, administer vitamin K? No, he's lower, right? So we want his blood thinner. Vitamin K is utilized as the antidote, right? If the number is too high because he's too thin, right? So that's not even the problem we have here. B, we know it's not a normal INR for his scenario. C, do you want to increase the Coumadin dose? Yes, you want to increase that Coumadin dose by 2.5 milligrams so that we can get them a little bit thinner. And I know it's because it's the opposite from the presentation that it gets confusing sometimes, but think of it like this. I always say, think about what we're doing. We are providing anticoagulants, because they are blood thinners, right? So we give it to thin the blood. The number increases the more thin it is. It decreases the more thick it is, right? Because we're giving it to you to thin it. So we're going to give you more if we need it thinner. So we want that number to be between 2 and 3. So I need to give you more of the thinner, right? So increase the dose. We increase it 2.5 milligram increments to gradually see the adjustment. And I know when you do it in practice, it's a bit different. You know how patients are. You talk about the diet. You do all those things. For testing purposes, make sure you do the standard 2.5 increase or decrease. Okay. And then lastly, question number 3. The nurse practitioner and NP student are discussing the term that is defined as the ability of a test to correctly identify those with the disease. What term are they discussing? Is it A, specificity, B, positive, C, sensitivity, or D, negative? Tell me what you got in the comments, you boys. All right, so some of the question states, what term are they discussing? So it says the nurse practitioner and NP student are discussing a term that is defined as the ability of a test to correctly identify those with the disease. All right, so we know when you're thinking about your non-clinical content, you're thinking about the things that we have in practice, specificity and sensitivity are some of those terms, and I know it can get confusing. But this is one of those knowledge based questions. The answer is C, sensitivity. Sensitivity is the term that is defined as the ability of a test to correctly identify those with the disease, the positive, right? So I always say think of sensitivity because it has 2 T's. It looks like a plus sign. The positive of it has more T's than specificity. And to think of it like this, it's sensitive. It is giving you who is sensitive to the results, right? To your whatever is being tested. It's so sensitive that it correctly identifies those who have it. Almost think about a pregnancy test. When you are more pregnant, and your HCG levels are uh, higher because you are further along in your pregnancy, the sensitivity for that positive comes quickly, right? Because it's more sensitive to it. So it's going to find those that are correct. And I say, when you think about specificity, now we're looking to be more specific. We're looking to see what is negative. So that's, sensitive is what we're more sensitive to, and you're getting that correct positive, those who have it, those with the disease. Whereas sensitivity, it's for with specificity, it is with that specific finding of those without the disease, the negative. And I know that can be, lengthy and kind of confusing. So when in doubt, no, sensitivity has 2 T's, looks like plus signs, the positive. Those are the ones with it, okay? So again, best answer choice is C, sensitivity. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure you meet me back here. And if you need any of our resources to assist you with any of your exams while in school or preparing for boards, give us a call at 803 400 6864. You can shoot a text to this number as well or email us at the number one at gmail.com. We offer a variety of services. There's a review book that you can access via ebook or you can have it shipped to your home. Both are linked in the bio of this channel. We also offer self-paced courses that you can work through all of the systems, the video, the downloadable PowerPoint workbook, and the mini quizzes at your own pace. We have a 5-week course where we work through all of the systems together. Assignments are provided daily, Monday through Friday, and then we also meet weekly as a group to do practice questions live. And then that last week is an individualized week where we work together, myself and each individual student, to gauge where you are, your exam readiness, feedback based off of all of your assignments that you completed, for advice and tips on how to move forward after this class. It may be, hey, they're doing well, go ahead, you are ready to test, or hey, I'll work on these areas, what have you. We'll have all of those sessions with that. And that enrollment is open because our next class starts on June the 10th, or you can do our one-on-one uh, review sessions and packages. We have it based off of weaknesses, or if you are struggling with a particular area, we work on that. Or we also do one-on-one sessions, which is our custom package, which is the most common one for people who may have been unsuccessful before or just don't know how to structure their studies and looking for guidance to help gauge where they currently are, design a study plan for them, and work alongside you to your exam success. But again, if you need us, just give us a call at 803 400 6864 or shoot an email to the nursing studio one at gmail.com. But y'all know what to do. Make sure you meet me back here. Happy studying. Bye, y'all.